Hi, this is Dr. Robert Chao coming to you on Room Now from ACR Convergence 2020. I wanted to share with you two exciting abstracts today, both of which were oral presentations on the treatment of dermatomyositis. The first abstract was 0955, presented by Dr. Agarwal. This was the first placebo-controlled randomized controlled trial of IVIG for the treatment of dermatomyositis. There were 95 patients included with active disease, and these patients were currently on either standard immunosuppression or previously failed immunosuppression. These patients were then randomized 1-to-1, either receiving IVIG or placebo. The primary endpoint was a minimal improvement of 20 points of the total improvement score, which includes muscle testing, physician and global assessment, the HAC, enzyme levels, and extramuscular disease activity. 79% of the patients treated with IVIG met the primary endpoint versus only 44% of placebo. The secondary endpoints were either moderate or major improvement in the total improvement score. And likewise, 68% versus 23% met the moderate improvement, and 32% versus 8% met a major improvement. Also, these findings persisted until week 40. The safety profile, the main adverse effects were headache, pyrexia, and nausea. There were 3 serious adverse effects compared to 2 in the placebo group, and the serious adverse effects were thrombotic events, which we know are common related adverse effects from IVIG. The second abstract is 0958. This abstract was also presented by Dr. Agarwal. This was a phase 2B double-blinded controlled randomized controlled trial of tocilizumab in the treatment of dermatomyositis. Again, patients were randomized 1-to-1, receiving either tocilizumab or placebo. These patients had refractory myositis, so either they had steroid failure or failure with at least one immunosuppressive agent. This study only had 36 patients, with the primary endpoint again being the total improvement score. Unfortunately, this study did not meet the primary endpoints. 26% of tocilizumab patients versus 29% had minimal improvement. There was no moderate or major improvement either. Furthermore, there was no significant change in steroid sparing effect. There was one serious adverse effect, which was infection with the tocilizumab group. I would say overall, these abstracts did provide promising and reassuring data on IVIG treatments, especially for this very complicated and difficult to treat disease. But unfortunately, there was no response as far as tocilizumab goes. However, it's still kind of unsure if we should use IVIG as a first-line therapy, as a second-line, third-line. Again, this study by Dr. Agarwal, they used IVIG in concurrence with immunosuppression or previously failed immunosuppression. I would also like to know, can IVIG be tailored to specific dermatomyositis manifestations? I would like to see data on IVIG, especially related with extramuscular disease activity. As we know, dermatomyositis has a lot of extramuscular manifestations. I know that these studies will help me decide the way I practice and treat patients with dermatomyositis. I hope this was beneficial for you. Thank you for tuning in, and follow Room Now for full coverage of ACR 2020. And please follow me on Twitter at Dr. RBC. Thanks.